Cory. Welcome. Thank you for being here today.
Yes, my pleasure. Thanks for having me.
So, I love discovering really cool, really innovative, influential people in the health space. And I found you to be really compelling and candid and honest about your work and your own personal journey with PCOS. I would love for you just to go into exactly what this illness is and some of the symptoms.
Yeah, thank you. I appreciate that. So PCOS stands for polycystic ovary syndrome, and it's actually pretty common. They estimate about 1 out of 10 women have PCOS, and it is the leading cause of infertility. So basically, what it is and why it kind of what makes it so complicated and complex is that it can really show up and look differently on everyone. So you have to meet 2 out of 3 diagnostic criteria in order to be diagnosed. And that could be elevated androgens, which are male sex hormones, either clinically or symptom wise, polycystic ovaries, which you could see on an ultrasound, and then also irregular periods. So that it could kind of range from having no period to having constant bleeding or really irregular spotting, irregular bleeding patterns.
Is there pain associated with PCOS?
There is not. That's a great question. That's a very common misconception because when you think of the word cyst, polycystic ovaries, you picture those big cysts that can rupture and cause a lot of pain. That's actually not the type of cysts that women with PCOS experience. They're really just tiny, underdeveloped, immature follicles, and they're all competing to ovulate, and really nobody wins. So there's no pain. Pain is not a symptom of PCOS.
That makes sense because, being that we talk a lot about endometriosis,
Yeah.
there's the association is always painful periods or pain outside of your menstruation cycle and also painful cysts. So that is an interesting difference. But what are some of the other symptoms that might lead someone to say, hey, I might have PCOS?
So elevated androgens can cause a whole range of symptoms, and they can look like acne, hair or like facial or body hair growth. So that would look like chin hair, chest hair, belly hair, nipple hair, and then hair loss on the head as well. And because there is this huge connection to insulin resistance, there's a big weight connection, and women with PCOS have a lot harder time maintaining their weight or losing weight. So they find that they have, kind of experience weight gain more easily.
And is there any kind of diagnostic test that they do, or is it more of going off of the symptoms?
Yeah, there's no one PCOS test. So I will tell anyone who's interested in kind of exploring and ruling that out potentially to ask for a full hormone panel from their doctor, and that will include testosterone.
With the diagnostic test, is there any kind of surgical approach or methodology that they use to intervene with PCOS?
Not so much surgical. If somebody's looking into infertility options, they might go to medication first, try to stimulate ovulation, stimulate the ovaries to ovulate. They might go towards IUI or IVF, but it's not similar to like looking into taking out endometriosis and removing tissue like that. It's more treating the insulin issues and the hormone imbalances. And that can be, because it looks so different on everybody, that can really be sort of a tricky way to figure out how to remedy the condition and some of the symptoms.
For you and your journey with PCOS, how did you figure it out? Because I read that it took you a long time to finally get a diagnosis.
Yeah, that's really common. Kind of like with endometriosis, it can take many different doctors, many different tests. And that's just because, again, it looks so different on everybody. So, you can kind of maybe have an inkling that you might have it. If you've had irregular periods your whole life, I hear all the time, and I experience this too, when you're younger, you're past puberty, but maybe you're in high school and your girlfriends are talking about their periods coming every month. And you're like, well, wait a minute. I haven't seen mine in like 6 months. Is that weird? So you can kind of have an inkling, or maybe, for somebody who has elevated androgens, they're having facial hair, and that doesn't feel normal as a woman. So yeah, sometimes it can take several different doctors and a long time to get that official diagnosis, kind of like with endometriosis,
Do you
unfortunately.
have any recommendations on how to speak to a doctor about this, or what kind of doctor to speak to?
You can go to your primary care. You can also go to an OBGYN. If you're looking into fertility treatments, you'll want to see a reproductive endocrinologist, so an RE, not REI, RE. But I would say, it's difficult for us a lot of times to advocate for ourselves in
Yeah.
a doctor's office. We only get a very limited amount of time. And of course, we have a million things that we want to say, and then once we get there, we forget. So I would bring a list of questions and symptoms. What are the symptoms you're experiencing? Why do you think you might want to get checked out for PCOS? Ask for the hormone panel, ask for a pelvic ultrasound, and ask for a fasting insulin or glucose and A1C check, because that's going to test your blood sugar. And there's a huge connection between blood sugar and hormones and PCOS.
Mhm. No, that's great advice, because I think you are right. When you get to the doctor's office, it's
Yeah.
overwhelming. You seem to forget the symptoms. So to write your own checklist of what you're experiencing to
Right.
advocate is really great.
Yes.
Um, for you, what brought you to getting into the world of the link between nutrition and PCOS? Because you are a registered dietitian.
Right. Yeah. No, when I opened my private practice, I said I will never go into PCOS. It's too complicated. But the more that I sort of dove into things, the more I realized there is such a lack of care out there for us and such a lack of knowledge, so much misinformation, very black and white diet approaches to PCOS, which is totally unreasonable and not sustainable. So I think just seeing that lack of basic care that women with PCOS are getting, and the information that they're getting in the doctor's office is either take a pill, you take birth control, or lose weight. But there's no other alternative for them, for us, I should say, because I have PCOS too.
Right.
So, there's so many things we can do from the nutrition side of things, as far as balancing our blood sugar, because again, that connection between blood sugar and PCOS is so critical. So
Mhm.
teaching women how to eat to correctly have their blood sugar be nice and happy throughout the day can be really key at sort of, there's no cure for PCOS, but kind of putting symptoms into remission, I like to say. So huge tie between that. And that's where my role as a dietitian really kind of shines, because of that really critical link.
I think when they say lose weight, that comes across to me just so dismissive, because
Yes.
you're having an insulin resistance and you have a chronic illness that is causing your body to fluctuate and to
Yeah.
not be able to process sugars in the right way, or fats in the right way, or what have you, or metabolize food.
Hmm.
Wouldn't a doctor realize that that is an impossible task for someone to manage on their own without some sort of medical or expert intervention?
Yes, the answer is 100% yes. And that's why so many of my clients will come to me and say, "Oh, I talked to my doctor. They're so happy I'm working with a dietitian." They recognize the link, but doctors are obviously brilliant, and they have, by no fault of their own, they have very little time with their patients, at least here in the US. So to give a full comprehensive nutrition, guidance plan is difficult and really outside their scope, I will say
Yeah.
also. So it's the disconnect is definitely real, and patients are feeling that, and that's why they're seeking out, people like dietitians who can help with that and kind of step into that role.
I know this is very generalized, one size fits all, but what are some absolute triggers for PCOS?
Triggers. Yeah. So
Yeah,
it's
yeah.
again, like, depending on what type of PCOS you have, but a really high carbohydrate, low protein, low fiber, kind of like high processed food diet can be a trigger for many of us, because our blood sugar is just like this. It's on a roller coaster all the time, and that sends signals down to our ovaries to pump out more male sex hormones. That
Wow.
causes our periods to be all wonky. That causes more acne, more hair growth, more hair loss on the head, more weight gain. So I would say for many of us, that's a trigger. Another one is stress. There's a huge adrenal stress connection with PCOS, because they find that women with PCOS tend to have higher levels of cortisol. Cortisol is our stress hormone. So really dialing into stress management, and sometimes our bodies are just more sensitive to stress. We
Mhm.
can have the same sort of amount of stress as the woman next to us without PCOS, but our bodies are dramatic and they respond accordingly. So really dialing into a solid self-care routine and stress management, easier said than done, you know,
Yeah.
that's a huge tie as well.
No, that definitely makes sense, because I realized with having endometriosis
Yeah.
that when I get really stressed out or I have a very stressful life event, I
Mhm.
usually end up getting sick. It's very closely tied. And I'm like, how do you manage this? And you try the holistic approach, the diet, the trying to calm yourself and not respond. But sometimes it's just impossible. Like you said, the body acts on itself, onto itself. You
Yes.
can't really, no
Mhm.
matter what, it's very difficult to do.
It is.
And I was reading too on your website, which was incredibly informative, that there can also be I don't know if this is the proper terminology, but you can have a dual diagnosis of endometriosis and PCOS. And it always seemed like anytime I would talk to a doctor, in the past, like an OBGYN, they would say, no, usually if you have endo, you don't have PCOS. It
Mm.
does not, doesn't really co-occur. And I'm like, I don't know. I kind of think it could. So can you clarify that a bit? Just for me personally, I'm very curious.
Yeah, there's a definite connection. We see a lot of PCOS with endometriosis and also thyroid issues, hypothyroidism, Hashimoto's. Yeah.
Yeah.
Yep.
Yeah,
Very, very real.
I developed, or at least caught it after I had my son and I went through aggressive
Uh-huh.
IVF. Then
Uh-huh.
I started developing hypothyroid and everything was kind of out and I kept losing a lot of hair on top. And I can look at pictures and I'm like, how did we not catch this sooner? Because it was so
Uh,
clear, like the
yep.
dramatic hairline loss and
Yes. Yep.
the, just sluggish and feeling really off and
Mhm.
all of those signs. So I wondered, like, was it the cause of the IVF drugs and the pregnancy, or was it always kind of an underlying thing that just was always there but not caught?
Right, totally. I know. I think a lot of us with any of these conditions wonder, was it the chicken or the egg that came first, or what triggered this big flare up, or what triggered this diagnosis? It's kind of a constant journey, figuring out what are your drivers, and everybody's different, everybody's unique, and what's causing those flares, what's causing those triggers. So the deeper you can dive into your own triggers and understanding your own body, I always say knowledge is power.
Yes.
The more you know, the more the merrier.
The more you know, the more the merrier. And
Yeah.
and also
Something like
this is
that.
almost its own topic in itself, its own episode in itself. But just to touch upon PCOS and infertility,
Yeah.
like you said, it is the leading cause. I had a friend who went through her IVF journey, but she said, oh, when they did my egg retrieval, I had so many eggs, but they said not every egg would be viable. Wouldn't necessarily have the quality that they needed just because there was a high egg account. Again, a
Mhm.
high egg account, sorry. But
Yeah.
again, it kind of goes back to the individual. But that was something, I heard multiple times from women with PCOS, they had a high egg count. And
Yep.
I don't know how that necessarily works.
Yeah. So it is tricky, and there's a lot of gray area in what we know and what we don't know. But typically egg quantity and quality are not the issue for women with PCOS. The
Hmm.
reason why PCOS is the leading cause of infertility is because anovulation. So a lack of ovulation. So a woman with PCOS, and this is not everybody, but
Mhm, mhm.
we'll say a typical woman with PCOS will ovulate 3 times a year. A woman without PCOS will ovulate 12. So her chances are significantly lower. And if she's coupling those 3 ovulation cycles with maybe poor timing as far as unprotected intercourse, or maybe there's another sperm issue, or maybe she's 39, 40 and her egg quality, just
Yep.
because it does decline as we age, is lower, all those things are working against her on top of that lack of or basically ovulatory dysfunction.
Mhm.
So that's really the reason. It's not so much infertility tied to egg quality, or that we can't get eggs when we go through an IVF cycle. It's just the ovulation issue that's the biggest factor.
Oh, that makes a lot of sense. No, thank you so much for educating us today about this. I feel I feel like this is a disease that really does deserve a lot more of a spotlight and more conversation. And thank you for what you're doing with your platform and helping others.
Absolutely. I love showing up there every day. I love being here. I love helping women and all my clients. It's a pleasure.
Thank you.
Yes, thank you so much.